suppose diabetes in general, it's estimated that it occurs in approximately 5% of the Irish population, that prevalence increases as you get older, and 90% of that is made up of type 2 diabetes. Initially, it may present with the person actually coming in, but in the majority of cases, certainly in the ones that we would diagnose in practice, if you have some degree of alertness to what may be presenting as diabetes, you can actually pick it up quite early in the course of the condition, before the complications have presented, because invariably if the complications do come, in the majority of cases they're irreversible. They're treatable, but they're irreversible. So for example, we would tend to look at people obviously who are symptomatic, so somebody coming in who's got polytipsia, polyuria, we might dip the urine, we might check random sugars and then go for fasting sugars and that. Anybody aged over 50, the incidence and prevalence increases with increasing age. If there's a family history, particularly a first degree relative, mother, father, brothers, sisters, that would increase your suspicion. Obviously somebody who's obese, somebody who's got existing vasculopathy, so people who have angina pectoris, people who have had stroke, have had myocardial infarction, peripheral vascular disease. The very fact that you attend at your general practice, at your GP, those patients actually have 2 to 3 times the chance of having diabetes as people who don't attend. So that's another good group just to look at. Mothers who've had large babies, say greater than 9 pounds in weight, macrosomia, I suppose a lot of those now would be picked up as having gestational diabetes, but before we were testing for that. Certain medications such as steroids and perhaps high dose thiazide diuretics can be associated with it. Lower socioeconomic groups as well, the incidence of diabetes is commoner in those groups. And then finally, people presenting with recurrent infections, recurrent skin infections such as cellulitis, recurrent candida infections, that kind of thing.